Hi everyone, my name is Sarah and I'm with Apollo Insurance Group. We know health insurance is the last thing that you want to think about when it comes to hitting to the golden age of 65 or when you're retiring. We know it's confusing, and entering the world of Medicare specifically can be really intimidating. You worked hard to get here, so congratulations. Here at Apollo, our mission is to positively impact people's lives, and that includes you. We listen, we educate, and we keep things simple so you have less to worry about when it comes to your health insurance. So the purpose of this video is to help educate you on how to sign up for Medicare once you turn 65 or when you're retiring. It'll have a brief explanation on what is covered in Part A and Part B of Original Medicare, and then the next steps to take after. The first thought that most people have who are new to Medicare is, how and when do I sign up? So there are two ways that someone can sign up for Medicare when you're turning 65. One, if you have already been withdrawing Social Security income or SSI, you will automatically be enrolled in Medicare Parts A and B. You'll be mailed your red, white, and blue Medicare card as you become eligible within the first 3 months leading up to your 65th birthday. Number two, if you are not withdrawing SSI, you will not be automatically enrolled in Medicare Parts A and B. You can sign up for your Parts A and B as early as 3 months before you turn 65. At the latest, 3 months after you turn 65. Not signing up for Medicare when eligible could cause you to have penalties if you decide to get it later. The easiest and fastest way to sign up for Medicare is to sign up online at ssa.gov. I'll repeat that again, that's ssa.gov, and create an account. You will need to fill out an application that should take you no more than 15 minutes to complete. In about 2 to 3 weeks, you can check to see the status of your application online. Once approved, you will receive an award letter on your Social Security Administration account that informs you of your Medicare number and effective dates for Parts A and B. Those are some of the most important pieces of information when it comes to your Medicare coverage. Sure, you can call Social Security if you want, but you're going to be placed on hold for hours, so ssa.gov is going to be your best bet. If you are turning 65 and you still plan to work, you can always give us a call, and we can let you know if going on Medicare would save you money compared to staying on your employer coverage. If you decide to stay on your employer coverage past 65, you'll be awarded what's called a special election period to sign up for Medicare when you decide to retire. All right, so now we're going to be talking about the most important part when it comes to the coverage, right? So we're going to be talking about Medicare Parts A and B. So we're going to go right into that. First, Part A covers your hospital insurance. So this portion of Original Medicare covers inpatient hospital care. So if you were to stay in the hospital for any given amount of time, it also includes skilled nursing facilities and hospice care. For most Americans, there is no cost premium for Part A of Original Medicare. If you worked for 40 quarters or 10 years, paying into Social Security, you qualify for a $0 Part A premium. Or if you were married to someone for 10 years who worked the required 40 quarters or 10 years, you also qualify for a $0 Part A premium. As mentioned earlier, this part of Medicare covers inpatient hospital stay. But if you were to stay in the hospital in 2022, you would be required to pay a $1,556 deductible, which covers 60 days post-charge, which means after getting out of the hospital. If you were to stay in the hospital again within that 60-day period, you're not required to pay that deductible again. But if you were to stay in the hospital again on the 61st day, you would be required to pay that $1,556 deductible again. So this deductible could be paid multiple times in a year, racking up some bills. So Part B of Original Medicare covers the outpatient portion or medical insurance of Original Medicare. Outpatient care includes doctor services, outpatient surgeries, diagnostic tests, ER visits, ambulance services, durable medical equipment or DME, so those would include things like wheelchairs, walkers, CPAP machines, etc. Outpatient mental health, outpatient physical and occupational therapy, including speech-language therapy. In 2022, the average American is paying $170.10 a month for Part B of Original Medicare. This premium is determined by the Income-Related Monthly Adjusted Amount, or IRMA. If you are making more than $91,000 a year, your Part B premium will be higher. This premium is determined based on your income 2 years prior. If you made more than $91,000 as an individual or $182,000 as a couple 2 years ago, you'll see an increase in your monthly Part B premium. Part B has a deductible of $233 for 2022. This amount has to be met before Medicare starts covering 80% of any outpatient medical services. Once that $233 deductible is met, Part B covers 80% of your medical services, and you're left with 20%. You're responsible for 20% of a bill. If you were to have a $10,000 surgery, Medicare covers $8,000 of it, while you are still responsible for $2,000 of that $10,000. There is no max that you pay on services. Now, 20% isn't so bad when it's 20% of 100, but 20% of a $10,000 ER bill would leave you with a $2,000 bill. Part A and B do not have a maximum you can pay either, so you could potentially receive bill after bill with no maximum to protect you. There are a few things that Original Medicare Parts A and B do not cover, so things like dental, vision, or hearing services. They also do not cover prescription drugs. Now, this is why most Americans choose to get secondary coverage to protect them from that $1,556 deductible and the 20% that Part B doesn't cover. So with all of that in mind, have you thought about how you would cover the 20% Medicare doesn't cover? At Apollo, we specialize in helping seniors in all stages of life and all lifestyles find coverage that helps them feel safe, secure, stable, and free when transitioning to Medicare coverage. We do this by finding you the plan that meets your specific healthcare needs and wants, and empowering you with the understanding of Medicare and your coverage work. Now, this is why most Americans choose to get secondary coverage to protect them from that $1,556 deductible and that 20% coinsurance from Part B. So with all of that in mind, have you thought about how you would cover that 20% Medicare doesn't cover? At Apollo, we specialize in helping seniors in all stages of life and all lifestyles find coverage that helps them feel safe, secure, stable, and free when transitioning to Medicare coverage. We do this by sorting through your options that fits your specific needs and empowers you with the understanding of Medicare and how your coverage works. We are ready to positively impact your life. Click the button below to schedule your no-cost consultation.